Well, Dr. Moldovan, thank you so much for joining us, Fad Medicine. We wanted to start off and just tell you a bit about what the podcast is all about. So, as hopefully you can tell from the title, we are hoping to illuminate practices which we might consider less than optimal or bad in medical practice, and I would include dentistry, of course, as a critical part of the medical practice in this country. So, um, not everything everyone does is good, and hopefully by shedding some light, we can help a lot of people. So, thank you so much for coming on the show.
Yeah, my pleasure, Nick.
Thank you.
Yeah, unfortunately with dentistry, there's a lot of procedures that have been stuck in the dark ages. There's time for an upgrade in a lot of the
Yes.
dental offices, and I'm hoping to bring some light on that topic.
Yes. So yeah, I'd love to hear your journey from Romania to where you are now. Yeah, with a podcast and a book. We'll talk
Yeah,
about.
I'm a double board certified periodontist and nutritionist. So what a periodontist is, we deal with the foundation of the mouth. Peri means around, dontist means the tooth. So we're dealing with the structures around the mouth. But I never understood why I did a certain procedure on two different patients. One patient healed great and the second patient didn't heal well at all.
You're saying you never understood why there was this kind of two.
Yeah, so how come somebody heals great and another person doesn't heal well at all? It's really because something to do with nutrition. So I started to dive into nutrition to see what we can do in the dental office in order to help patients heal better. And in exploring that topic, I realized that certain nutritional therapeutics are so beneficial, for the dental office. And also I started learning about the microbiome, which we're very much into in our practice over here, is looking at the microbiome fingerprint in everybody's mouth and see how it influences their longevity. So, fast forward, now we have 3 locations in Beverly Hills, Encino, and Newport Beach. And my mission is really to educate millions of people on the importance of oral health when it comes to overall health. I think it's just really not talked about enough. And for dentistry in general, in dental school, is more like, okay, we have a tooth, it's got a hole in it, let's fill it. But there's just so much more to it than that. It could be so much more rewarding. And, I've been an educator in the dental community now for 20 years. So my mission is really to get dentistry to the next level of practice and help as many people as possible.
We love it.
Gosh, that's so wonderful to hear, because like on my intake form with my clients, I just have an entire, part of the form is about the mouth, about mercury amalgams, how often do you go to the dentist, what happens, gums and, receding gum line. So many questions that I ask, and my clients always say, my gosh, there's so many questions about the mouth. And that's what I really hope, is just educating them to ask the right questions of their dentist, because sometimes it's like you go to a routine checkup, and there's nothing more. I mean, you're either a perio patient or you stay with your dentist. Could you explain to our listeners why it is so important to look at your mouth as a gateway to health?
Well, number one, the mouth is the opening of the GI tract. And a lot of people have gum bleeding. So what happens when you have gum bleeding is the trillions of little bacteria that are present in the mouth have an opportunity to enter the bloodstream and travel. They hike a ride on the blood vessels and they end up in the joints, the heart, the brain, unborn baby, the lungs, all kinds of areas where they shouldn't be. And they form a home there. So that's why it is so important to understand that the mouth shouldn't be bleeding, just like your hand shouldn't be bleeding. A lot of people think, my gums are bleeding. What's the big deal? But it is. It is because of the little bacteria that can get inside the bloodstream. And I think that's the missing piece why people don't connect, because when gums actually bleed, there's an interaction between the microbiome and the inside of our body.
Right. They do teach that in medical school. Endocarditis is a heart infection, and that is very well taught. Actually,
Absolutely.
Yeah.
And at the VA, they've done a VA study at the VA hospital, and they've actually shown that after dental cleaning, there's a transient increase in bacteremia
Yes.
within 10 minutes of a cleaning.
Yep. Yep.
Yeah. So the healthier your gums are, the less of a chance that increase in bacteria in the bloodstream during a cleaning will happen. So
Yeah.
super, super important to keep healthy gums.
So healthy gums is the mantra here. For someone who is new to this, they go to their dentist every 6 to 12 months, and they have bleeding from time to time, don't think it's a huge deal. Where do they start? What's kind of maybe a good entry point for a patient to start?
I always say start with home care.
Okay.
Because it's the easiest thing, right? A lot of people try to avoid the dentist. So my 3 steps to optimum oral health are: number 1, brushing. And it doesn't matter if it's electric or manual. I find that some people do a great job with a manual brush. Second step would be water flossing. String flossing, most people don't do correctly. The studies that we have today is that water flossing is a great alternative to string floss. It actually does a better job. It gets rid of a lot of the bleeding when we use a water flosser. So using a water flosser twice a day, every day, is hugely important to get rid of the bacteria that's in between the teeth, as well as the outer part of the teeth. And third step is using a chewable probiotic. The research on chewable probiotics has been tremendous. We use it a lot in order to decrease plaque formation, for cavity prevention, and really in our oral microbiome reset protocol that we do here at the practice. But anybody can do these 3 simple steps at home.
Is there a strain that you recommend, like Lactobacillus reuteri, or?
Full disclosure, I have a natural oral care product called Orasana. I've done a lot of studies, a lot of research in the world of oral microbiome. So I have a product, a chewable probiotic mint. And how this product came about is that I was using a oral probiotic from the market about 10 years ago after our deep cleanings. And our patients hated the flavor. So nobody would take it. It's like, do you have anything better? It was kind of chalky, It was like some of my vegan patients. Oh no, it's got dairy. I'm not doing this. So I'm like, okay. I worked with a chemist here in the United States, and we came up with a pretty good formula. As a matter of fact, a patient the other day said, "Why did you make them so tasty? I just want to eat them like a candy." So I said, okay, I know I got a good formula.
Yeah.
Because that's the point. We want to have that. So there's a multiple strains that we look at today. A few of the lactobacillus species have been shown to decrease cavities, decrease inflammation when it comes to the cytokine levels in the saliva. There was actually one study that showed increase in bone density in 1 year use of oral probiotic. We don't know exactly why that happens, but we definitely know there's an association there with just healthier tissues in general. Also, not only teeth, but when it comes to dental implants, certain strains of the oral probiotics have been shown to decrease inflammation around dental implants without doing anything else, just taking that one lactobacilli species.
That's wonderful. I mean, I always recommend curcumin or like a polyphenol-rich diet. Have you seen that being useful to your patients as well? Something that is kind of helps with systemic inflammation that also shows up in the mouth.
So, curcumin is a great product. We use it also for mercury detoxification when we remove mercury from the mouth, because curcumin also helps with the detoxification process.
I just remember as a child, my mom used to make a turmeric paste along with clove, which is so high in antioxidants and polyphenols. I mean, we didn't know all that. It was just something that they use turmeric for everything. Like you get hurt to stop the bleeding, just in the mouth. And so now it's like taken off and everybody uses turmeric, for.
Yeah, very true.
Shall we get into some bad medicine? I'd love to hear your take on what are some medical dental practices that you think are better left in the history books. that could be improved upon?
Well, since we're on the microbiome topic, what I would say is the deep cleanings. To me, it's such an archaic way of treating gum disease and oral inflammation. I like to have a holistic, with a W, holistic approach to oral health problems. So basically, when somebody has bleeding gums, the dentist, they said, "Oh, you need a deep cleaning, but we're only going to do it around the two back teeth that have the deeper pockets. But what about the rest of the mouth?" So that's why in my practice, we do an oral microbiome reset technique where we actually clean the entire microbiome. That's on the roof of the mouth, that's on the tongue, that's on the cheeks and the adjacent gingiva, not just under the gum, because then you're really not affecting anything if you're just doing the deep cleaning that way. So that's one area where I think we could do so much better.
I have lots of my patients telling me about their scheduled deep cleanings. It's pretty common.
Exactly.
Yeah. So Dr.
But
Sanda, go ahead. Yeah.
When it comes to other things like mercury removals, right? A lot of people have the silver fillings. Well, the silver fillings actually are about 50% mercury. And the bad medicine is that dentists remove them with no protection. And when you cut into a mercury filling, actually there is so many vapors coming off that filling that are odorless, and they get basically inhaled by the patient, the dentist, and the assistant sitting there. And that's how a lot of dentists and patients become toxic with high levels of mercury.
So your practice is more holistic, right?
Yes.
Can you just tell us what the difference is between a holistic dentist and just a regular dentist? I get asked this question a lot, and I'm not quite sure where the holistic part just kind of starts. And is it the procedures? Are the procedures different? Are the products that you use very holistic? So give us an idea of what holistic dentistry means.
There's many names of holistic dentistry. There's holistic dentistry, there's biological dentistry, there's integrative dentistry. There's a lot of different names, and different dentists interpret it in different ways. The IAOMT actually has a certification process in order to certify biological dentists, and that involves safe mercury removal of fillings. So we have a certain technique that we use in that process. However, some holistic dentists, for example, don't use x-rays, and I don't agree with that. I think x-rays are super important in order to diagnose early and diagnose things that are important. So not all holistic dentistry is created equal, for sure. Some holistic dentists just do cleanings and like little cavities, formation, things like that. In our practice, we have a multi-specialty practice. We have a lot of technology. But at a high level, integrative dentist, to me, it means diagnosing the whole, not just the whole. And what do we mean by the whole is the entire jawbone and the structures such as the sinuses, the submandibular space. So in our office, it's common for patients to get a CT scan, and it's common in many integrative or biological dental practices. The only way to truly diagnose holistically is with a cone beam CT scan. So in order to find a good holistic integrative dentist, one of the questions should be, are you using a cone beam CT scan to diagnose the mouth? If they're not at the level they should be, in my opinion. The second question would be, are you using ozone in your practice? If they're not, find another practice that does use ozone. Ozone is hugely important in the treatment of microbiome, in the treatment of cavities and cavity prevention.
How? I'm
Another
so curious.
question.
What do you do with the ozone? I didn't know this.
Yeah, we use ozone in the form of water in all of our units. So whenever our hygienists do cleanings, they use ozonated water.
Okay.
We use it as a mouthwash. We use it in order to stop the transmission of the oral bacteria into the body whenever we do treat.
Fascinating. Thank you.
So it really works on the biofilm, or?
Yes. So studies have shown that the moment you blow a certain concentration of ozone/oxygen as a gas onto the biofilm, basically it disrupts the cellular membrane of the bacteria, of the parasite, of the fungus. because we know the biofilm is not just bacteria. So that's what it does, and it kills them on an instant, without the damage to the person or to any of the cells that are surrounding that biofilm.
Got it.
Yeah, I recently had a guided biofilm therapy cleaning, which is very different from my regular cleaning. Is that something that you use in your practice?
We do. We
Yeah.
do use guided biofilm therapy as part of our protocol, for
Yeah.
sure.
It's called EMS or something, right? Yeah.
EMS is the name of the company.
Company, yeah. Okay.
But Airflow is the actual name of the device.
Mhm.
And we go an extra step. They actually use small particles of erythritol at 15 microns, basically to spray around the teeth and the gums and the tongue and the cheeks to eliminate the biofilm in a very efficient manner. And also the other thing I like about erythritol is that it's anti-cavity. So you're actually having a therapy for your teeth. It's not just a cleaning with scrapers. I think the scrapers, that dentists use are so archaic and they don't really clean well anyway. So using the guided biofilm therapy is such a much better way for us. That's the way we do all of our cleanings as well.
I've just
It
started.
was pretty neat.
I just started using the little erythritol in here. I happen to have this on my desk. Have you seen one of these before? These are the Neilmed nasal irrigation, and they have this is the plain one, but they have one that contains erythritol, and you put it in your nose. Obviously, this is all of these things are connected, so it got me thinking: is there I assume this microbiome, oral microbiome. I mean, this is shared in the nasal sinus. I'm sure this is all one. Yeah.
Yeah, exactly. So definitely also what we know about the chewable probiotics is they affect actually the breathing. And we have reports saying that they've cleared their sinuses just by changing the oral microbiome. So that's nice.
There we go. Yeah. I think we cut you off. You were saying that was number 2, number 3. But if you want to go on, we can move on.
Yeah. So another question to ask is, are you either using fluoride in the practice?
Okay.
A true integrative biological practice, holistic practice does not use fluoride in their office. It's really not necessary. There's other things that we could be doing, such as calcium hydroxyapatite in order to help to mineralize the tooth surface. It's something that's mimicking natural biology instead of just placing fluoride.
Yeah.
So looking for toothpaste that have that. Yeah.
Yeah, calcium hydroxyapatite. Absolutely.
We were gonna ask you about fluoride. It was on the list.
Yeah.
So what would you say? Like, it's the simplest way to explain why fluoride is suboptimal. Maybe it could be left in the past.
Well, left an impression for me was the Fluoride Gate documentary, which explained how fluoride ended up in the water, and as an agricultural byproduct. So it's really unnecessary to use fluoride. Luckily, my association had a battle now for years trying to get the fluoride out of the water. So finally, we won in a statement from the FDA saying, fluoride is really not safe at any level to be ingested.
Wow.
But so that just happened a couple of months ago. So we were super excited that we finally got that statement, them to agree to that. Now, when fluoride will come out of the water, right? That's still a process.
2 years,
Yeah,
I'm sure it takes a while.
A few years.
Unless you're filtering your water, right? At your home.
Exactly.
Yeah, fascinating.
But the attorneys did a great job in interviewing, the FDA, saying, why, all the research shows that no ingested fluoride is safe.
Yeah.
So we were very happy that we won that battle.
Not to toot my own horn, but I haven't used fluoride in like almost 20 years, so no cavities.
Yeah.
Awesome.
I don't use it either.
Exactly. It's not necessary.
Lovely.
Yeah.
How did you come about writing your book? Really curious about that. Yeah.
Yeah. So in my, I learned so much going to different conferences, and a lot of dentists don't have the luxury, to go to different like IFN, Institute of Functional Medicine conference, nutritional conferences, and even, patients would always ask me, oh, I have gum disease. Is there a pill that I can take to help me heal? Well, no, it's really a holistic approach. It's a lifestyle. So my book, Heal Up, is basically 7 ways to heal it from anything, not necessarily just oral, but it involves eating an anti-inflammatory diet, staying hydrated with the right kind of water, breathing, meditation and relaxation. Sleep is super important. The right kind of supplements. These are all things that I talk about in the book. They're all helpful. Like if somebody has the best diet, but they don't get enough sleep,
Yeah. Yeah.
it's not enough.
Is there I'm curious, what happens when you sleep in the oral microbiome? I would say morning breath is usually not considered a positive. So, so I'm so curious. Yeah.
Well, it's not considered positive, but it actually
Okay.
is. Because the sulfur-forming bacteria actually is good to produce nitric oxide.
Oh.
So
I'll tell
I'm
my
not a
wife
big
that. So
Exactly. Oh, you're just working on your nitric oxide formation.
Yeah, I actually take a supplement in the morning before brushing my teeth, which is like a beet supplement that converts the,
Whoa.
into nitrites. So I don't
I'm
know if it
behind over
helps,
here. Oh my
but
goodness.
I just find it exciting that that could happen because it's all happening in the mouth cavity anyway. So it's like, yeah.
Yeah, exactly. Yeah,
Yeah.
I'm not a big proponent of mouthwashes
Okay.
for
Yeah.
that reason.
Yes. Yeah.
Mouthwashes just basically kill more of the microbiome,
Yeah.
especially some of the Listerine products. They're
Mm.
so harsh. They have a lot of
Mhm.
alcohol, a low pH, and very, very strong essential oils. I think as long as we regulate the thickness of the microbiome through brushing and water flossing, is better. But all these antibacterials kill the good bacteria.
Mhm.
Because a lot of people go, right, the first thing they do if they have bad breath, oh, let me use a mouthwash.
Mouthwash.
But
Yeah.
but then you're decreasing that production of nitric oxide.
Okay.
How about hydrogen peroxide?
Hmm.
I like hydrogen peroxide, especially for people with periodontal disease
Mhm.
that have bleeding gums. Either we have them use ozonated water at home in their water flosser, or I have them put a teaspoon of hydrogen peroxide in the water reservoir of the water flosser
Mhm.
to help to control the inflammation.
Gotcha.
That
Gotcha.
is
That's
so
great.
cool.
And then I have to
Mhm.
ask about sugar. Sugar is such a big part of our practice. We talk about CGMs. We use continuous glucose monitors. And of course, I grew up hearing, the sugar's going to rot your teeth. I have to admit, in all of my counseling about limiting, sugar, refined carbohydrates, I don't think I talk about the mouth. And so maybe you're going to give me something else in my arsenal when I'm counseling patients about their oral health.
Yeah, and what's interesting with sugar, dark chocolate, let's say if you're going to have a piece of dark chocolate, it doesn't really stick to the teeth. So it's not as bad as crackers, let's say, like somebody has saltine crackers, those really stick to the teeth. Those are so much worse than a piece of dark chocolate, even though they're less sweet, because it's the starchy carbohydrates that stick to the teeth that actually become a problem when it comes to cavities. Because what happens when we get these carbohydrates, bacteria from the biofilm, especially the streptococcus species, they take this on and they release an acid. That acid release actually causes the enamel to dissolve. So when the pH is 5.5 or around there, then the enamel starts to dissolve and a cavity forms. So the whole goal is to eliminate any kind of, let's say, bananas also are cariogenic, we say, because they also can stick to the teeth. Dry fruits, if they actually, even though they're fruits and people say, oh, they're healthy. Not really. If they actually stick to the teeth, they can cause cavities.
Yeah. We see big glucose spikes from dried fruit, actually. It's
Oh,
one
yeah.
of the
Oh, yeah,
common,
that's
one of the
So it's
common
for the
ones.
volume. There's a lot of sugar in it.
Yeah.
So, Dr. Sanda, what do you think about dry mouth and what causes it? Do you feel like there's a connection with the oral microbiome? Give us a little bit of, because I do have a lot of clients who come in talking about dry mouths, so is there anything
Yeah.
specific?
Dry mouth happens for a few reasons. Sometimes it could be medication induced, especially people with ADHD medication, and even kids, right, who are taking ADHD, they can have dry mouth. It also can happen due to autoimmune issues like Sjogren's disease, where we actually have diminished function of the salivary glands. And also, then we have women menopause. Who actually will also experience dry mouth. So we have a lot of different reasons why dry mouth happens. Saliva is so important in tooth mineralization, keeping the microbiome levels healthy. So what we're seeing in it is when there's a decrease in saliva flow, we actually have an increase in plaque, and not necessarily the good plaque.
Yeah.
So that increase in plaque now can actually cause more inflammation, and we see gum recession starting to happen, and also increase in cavities. Also, people that are undergoing any kind of radiation or chemotherapy that is actually drying the mouth, that also we see a tremendous increase in cavities because of the lack of saliva. So what do we do for this? Number one thing I think is trying to stimulate salivary flow. And how do we do this? Via chewable probiotics with xylitol. The other xylitol I also like for oral health because it actually thins out the plaque. It prevents plaque formation, which happens in people with dry mouth. So, and also having a lozenge in the mouth stimulates the saliva flow. The second thing that's super important in people with dry mouth is to protect their teeth from breaking down. As we don't have so much saliva in the mouth, we have to now introduce the minerals on the teeth surface themselves to be able to mineralize. And why mineralize is because our diet can be acidic. Let's say, a lot of health benefits from drinking lemon water. Now, you get somebody with dry mouth drinking lemon water, it's really a big problem for the enamel. It's going to erode the enamel pretty fast, especially I have women that are like, oh yeah, I just sip my lemon water all day long. I'm like, oh my God, that's like the worst thing you can do.
Oh no.
Yeah.
If you're going to drink lemon water, just use a straw and drink it, within the hour.
Yeah,
Not
and
sip it all day long.
And
So
apple
really
cider
use-
vinegar too, right? I mean, that's
Eh,
another
That's
thing.
very hot right now.
Another one.
Yes.
Yeah, great for health, but just drink it.
Coffee,
Don't let it
my
sit.
beloved coffee as well.
Yeah, coffee's actually fine, especially now there's more alkaline type coffees, especially mushroom coffee. So yeah, and we don't see a problem with coffee. It's mostly the, like you mentioned, vinegar, lemon juice, orange juice, of course, Diet Coke, things like that, that can definitely dissolve the enamel. But what my recommendation is for that, again, the calcium hydroxyapatite that I mentioned earlier,
Yeah.
to really leave it on the teeth even overnight.
Huh.
As part of the Orasana line, we actually have a mineralizing tooth powder. And what we do, we actually have people just apply it on their teeth, leave it on overnight as a treatment in order, especially in people with dry mouth.
Wow.
So those minerals can actually soak in.
I love that. Amazing.
So do you see a connection between mouth breathing and the health of the mouth?
We do see a connection. What happens is mouth breathers actually have an increase in inflammation. And I think mostly has to do with that dryness that they experience, especially at night. The gingiva actually gets dry. So we have a growth of the disease type causing bacteria. So we do see a lot of gingivitis in people with dry mouth. I mean, with the basically like open mouth at night.
Yeah. Interesting.
That is so
You
interesting.
said, did I
Yeah.
hear you right? Good plaque?
Yeah, there's good
Oh,
plaque and bad
Now
plaque.
you're blowing my mind. All right, you got to tell me about the good plaque.
We thought all plaque was
She
bad.
must have misspoke.
Yeah, not all plaque is bad. So how do we test for that? We actually use salivary diagnostics. In my office, I use a company called Oral DNA. It's a simple swish. You swish for 30 seconds, spit in a test tube. And we do that test here for people that come in and say, you know what, I have brain fog, and we do see gum bleeding. We do test for that. Why? Because certain plaque, we call it bad plaque, because some bacteria in that plaque has been linked to gum bleeding and also brain inflammation. That particular microbe is called P. gingivalis. So if somebody has this, we want to do a full mouth detoxification and reset the microbiome. It is one of the more resilient type of microbes, so it does require a little bit more um, thorough type of detoxification of the microbiome.
Yeah.
So do you offer like an oral microbiome test? They are so super interesting, like as far as,
Yeah.
but I've not been convinced, because there's certain times like certain companies will say, oh, you have a lot of fusobacterium, and then there's this whole study about, is that good, bad, is that normal? So talk to us a little bit about oral microbiome tests, and should everyone be doing something like this as part of their practice to have healthy mouths?
So what we know about certain species in the oral microbiome is they can cause different types of chronic issues, such as brain inflammation, Alzheimer's, dementia, affect the unborn baby. Fusobacterium species have been linked to tumors in the
Colon.
gastrointestinal tract.
Mhm.
However, we classify the oral microbiome, the 11 types of species that are right now I'm looking at, into 4 of the aggressive types. And why we call them aggressive is because we know that if your gums bleed, those already will be traveling elsewhere in the body and they will cause other issues. So the 4 aggressive types of bacteria has been linked to irregular heartbeats, heart murmurs, brain inflammation, even oral cancers, one of them being a spirochete. A spirochete is a corkscrew type bacteria that can easily penetrate into the tissues. So it's very fascinating. In the last few years, we can actually understand the behavior of the different types of species of bacteria, and today easily test for it. So if my patients come with bleeding gums, I'm not just going to start, let me just start doing a deep cleaning. I think that's the worst time to do something, because now you're introducing bacteria that you know nothing about deeper in the tissues and in someone's body. So for us, we always test for the oral microbiome, 11 different species. And what I'm interested in the 4 most aggressive ones. And typically, if somebody has no plaque but bleeding, which can happen, then for sure they have some of those aggressive type of bacteria that we need to minimize for them. And we do that non-surgically via the oral microbiome reset technique.
I'd love to hear about the reset, because I came across a product. I won't name the company, but it was a very aggressive antimicrobial toothpaste, mouthwash. To me, it almost sounds like using broad spectrum antibiotic, which, I mean, I know that's not necessarily going to help. You might kill the bad, but you'll also kill the good.
Good.
I'm guessing your reset factors that in and replenishes the good, makes sure the good take hold and the bad are gone. Yeah.
So true. Yeah. I mean, the first step in the oral microbiome reset is to wipe off everything. Start with a clean state. Unfortunately, there's no way for us to separate, you're good, we're going to let you stay, and you're bad, and we're going to take out. Today, we don't have that technology yet to just take out the bad. But what we do know is that the biofilm likes to grow within the hour of getting a cleaning. So if you've gone to the dentist, within the hour, bacteria is back. So we're not so concerned about them not being able to, regenerate. But it's super important to eliminate and wipe off the entire microbiome and then help it populate in a good way. And also, of course, diet is a huge part of that. And instructing people what are some prebiotic foods, that are important to take
Yeah.
during
'Cause
this process.
some of those gut the mouth bacteria, if they're traveling into your colon, which is not very conducive to aerobic bacteria, that kind of gets you thinking about how did they travel all the way down here and what's happening in the entire gut, right? It's just very interesting how.
Exactly. I think we're still understanding so much of the microbiome. There's still a lot of species that haven't been identified. But when I went to school 20 years ago in my periodontal program, we just started talking about the different bacteria, but we treated everybody like the same way. Okay, you have gum disease, occasionally we would culture.
Yeah.
But the problem with culturing at that point, 20 years ago, is that a lot of the bacteria died in transit. But luckily, We have PCR testing today, so it's so easy to get an accurate read of what type of bacterial species we have in the site.
I have patients who very proudly tell me that they brush after every meal. Is this good practice? Twice a day, I believe, is the standard. So the frequency of toothbrushing, I think this is what the listeners want to know. Yeah. What's your stand on this?
Yeah. The general recommendation is brush and floss twice a day. Every day? Some people will build more plaque than others. So for those people, brushing like a third time is important. But if somebody's going to brush like 6 times a day after every snack, that might be a little bit excessive. And why would that be excessive? I think brushing in general, especially let's say they have something acidic. Like, they're going to have a nice salad with like vinegar, apple cider vinegar, which is very acidic. We have to allow the mouth to neutralize in the pH. So let's say if somebody drinks wine, that's a pH of around 3, you have to wait 30 minutes before going to brush your teeth. Because if you brush right away, now that enamel is already dissolved from the acid, it will recover with the salivary proteins and the minerals. But if you brush it right away, now you can actually damage the teeth.
Wow.
You just blew my mind. Amazing. Now I
The
have
New
an
York
answer.
Times. Yeah. I know the New York Times has an article almost every week about should we brush first thing in the morning as soon as you wake up or give it some time. It's like, I don't think we really have an answer, but I'd love to ask your opinion about, is there an advantage to waking up and brushing your teeth versus waiting a few hours and then maybe after your cup of coffee and then brushing your teeth?
I actually like to brush my teeth after breakfast, not before. But it depends, right? It really depends on somebody's comfort. Like if you have a significant other that doesn't want to have breakfast with you because, you have bad breath, maybe you want to brush. But again, the sulfur type of bacteria is not necessarily bad. So I'm not a believer that we have to get up quickly and go brush our teeth. Especially, one of the things we're noticing, if people that are taking regular chewable probiotics, especially at night, even if they have a dental appliance, such as a night guard, they don't build as much plaque at night. We actually see a thinning of the plaque. So, Nick, one of the things you might want to try is popping in a chewable probiotic at night. You might be surprised, in the morning what we're actually seeing when people wake up and, they stick out their tongue and they have a white coating on the tongue. When people use a chewable probiotic, that coating doesn't form. So the people that are listening and have this white coating on the tongue, try a chewable probiotic at night. I think they'll make a big difference in that level of coating.
I love it.
Nick, I can vouch for that.
Yeah.
Huge
All right,
difference
well,
with the probiotic at night.
I
Yeah.
have
yeah.
my
I mean,
marching
I
orders.
went in with a lot of trepidation. Like, is this for real? I was looking at all the research I could find about it before taking another probiotic, right?
Yes.
Definitely does make a difference. So,
Well,
Yeah.
I'm sold.
Awesome.
We have a little rapid fire round. Shall we move to it?
Yeah, I just have one question for Dr. Sanda before we move to rapid fire. Root canals. I hear my clients constantly saying, oh, I went to my holistic dentist and she or he recommended no root canals, better to take the tooth out. Is there an advantage to how do you approach it? And what would I tell someone, a client who's kind of weighing the options and deciding which one is better for them?
If we look at the studies of root canals, even in the Journal of Endodontics, which is the specialty that does root canals, they have the science to show that a root canal treated tooth has 50 times more bacteria inside of it than a healthy tooth. So, do we want that much bacteria inside a tooth? No. Because what happens? When a root canal is performed, the tooth is killed, the nerve is removed, and it's being basically stuffed with some kind of gutta percha. It's basically the bark of a tree to help to stop bacteria from going through the tooth and reaching the bone unfortunately, that plug doesn't hold very well. So I end up taking a lot of blackened roots that have been root canaled, and people have gotten sick from them. So I am not a big fan of root canals. I had one myself, which I no longer have. It was affecting my digestion. It was actually on the meridian of digestion. And it started bothering me because any time I flossed around it, it started to smell. And I'm like, why is it smell? My gums were
Wow.
always bleeding around it. So I finally made the decision, you know what, it doesn't have bone loss, but I'm going to just take it out because I don't think it's healthy. Just my intuition. So I felt so much better after I had this tooth removed. And for myself, I would never get another root canal.
Speaking of things starting to smell, tonsilloliths,
Yes,
feeling.
absolutely. They can cause bad breath.
Yeah.
And we do see them in
Oh, yeah.
patients, for sure.
Oh, yeah.
Yeah.
Very.
I see them on the CT scans, actually. When I take CT scans, I can actually see tonsilloliths.
Yeah. Any great advice for someone dealing with these? I have them irrigate them. It's kind of a traumatic thing, and then maybe a chlorhexidine mouthwash, but that's just kind of what I've done in the past. Yeah.
Yeah. So there is a way to get them out. There's a dentist that developed a procedure called tonsillase. We use it a lot more for kids, but one of the things we do with a laser, it's a laser type procedure to help shrink the tonsils. And before we shrink them, we actually take out the tonsillis. We can take them out to just like put a little topic on anesthetic and just pop them out if they're, more superficial, but essentially, and then we do a laser disinfection to help to shrink the tonsils instead of removing the tonsils. So, yeah.
All right.
That's amazing.
I love it.
Okay.
I love it. That comes up a lot, actually.
Yeah.
Yeah.
I myself had tonsillitis, so I've actually treated my own throat with a laser.
Oh,
And
wow.
I was so amazed of
Yeah.
how well it works in terms of disinfection of the
Shrinking up
tonsils.
those tonsils.
Amazing.
Yeah.
Well, I'm looking at our rapid fire, and I'm like, I think we kind of hit all these questions, but we could still.
We'll
I think we have
try.
like 2 left.
Well, it's almost like summarizing the whole episode.
Yeah, exactly.
All right, you ready? Like, just quick answers, yes or no. Food that everyone should eat for good oral health.
Fibrous food, I would say.
Okay.
Okay, you have to pick electric toothbrush or manual.
Manual.
Oh,
What tip flosses must have or overhyped?
A must for everybody.
Okay.
do you recommend oil pulling?
It depends. Yes, sometimes.
Okay, we'll take that. That's acceptable.
And if you do have to use a mouthwash, a date or a special occasion, and you need a mouthwash, what would be the brand that you'd recommend?
The only time we use a mouthwash is for people with bleeding gums, and it'll be Triology.
Okay. You heard it here first. Love it.
So, Dr. Sanda, tell us a little bit about your product, that you are a Sana, and how we can have our listeners maybe purchase it or, make it a part of your oral hygiene routine.
Yeah, it's a brand that started because I was tired of all the, killing bacteria type of products that are on the market. So the Orasana brand is a brand that nourishes the mouth and protects the microbiome. So it really involves the 3 steps to optimum oral health that I talked about. Brushing with a mineralizing tooth powder that I created. Secondly, using a water flosser. And thirdly, using a chewable probiotic. That's kind of our base of optimum oral health. And then we have inside of the Orasana brand different bundles for different conditions. Let's say somebody's suffering from TMJ. What can we do in order to relax the joint and give it the nourishing collagen peptides that a joint needs to regenerate? If somebody has dry mouth, we actually have bundles for that to help them with a dry mouth and to keep their teeth strong. And then we have people with bleeding gums or cavities, and we have different programs for them as well.
So sorry, I have one question I have to ask you, which is
Yes.
microplastics in toothbrushes. Do we need to be thinking about this? I know it's very hot right now.
They were actually right. So I think that the microplastic can be in the tubes of toothpaste. And there was actually a problem with one of the Crest brands. They actually had little beads of plastic in there to help to remove the plaque. That product is no longer on the market, but I think we see probably more microplastics. And actually, there was a study recently that found mold in a toothpaste tube.
Wow.
Tom's of Maine was the brand, and it was actually a natural brand. But
Yeah.
Tom's of Maine was purchased
By
a
Colgate.
mainstream. Exactly.
Yeah.
So they actually found mold. They upon an inspection, they actually got fined over this. So yeah, I'm more of a fan of a tooth powder. But we can give your listeners like a special link below.
Perfect.
A special
And-
some savings.
But in terms of the bristles, are we thinking plastic? There's plastic bristles. I assume those are plastic, right?
He's switching. He's
I
switching
don't
to
need. Do I have to
manual.
switch?
That's
I
right.
feel committed to my brand, but
Yeah.
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 So, it's interesting with the bristles because you can find like natural boar bristles,
Okay.
tooth brushes. But unfortunately, the boar bristles are too harsh. They're too hard for the gums. So
Sounds like it.
right now, really, the best bristles that we have are still plastic. However, we don't see necessarily like, inflammation from the because I
Okay.
do feel like the plastic, if it's embedded in the gums, will cause inflammation.
good. So I
I
can
think we
keep.
should go back to what my grandfather used to do. He used to use these neem sticks because neem is an antimicrobial, and he would actually brush his teeth with a neem brine.
Oh
With the
yeah,
plant.
that's right.
Yeah.
Well,
Yeah.
one day, when there's an update on the bristle problem, we'll have to come back.
You
That's
just come to my garden, pick a neem.
Thank you so much, Dr.
Thank
Sanda.
you.
This was amazing.
Thank you so much.